Hello everyone, my name is Richard Shah and today we'll be talking about point-of-care ultrasound basics. Learning objectives. We'll talk about ultrasound terminology, different types of ultrasound probes and their uses, addressing depth and gain, B mode versus N mode on the ultrasound, and different types of Dopplers. This is a picture of an ultrasound machine. So just a little background, ultrasound uses sound waves, just like a bat that uses echolocation, and it's got wavelength and frequency. Here are the different types of transducers that are mostly used on ultrasound. We have three types: linear array, curvilinear array, and phased array, also known as the cardiac probe. The linear probe has the highest frequency and the lowest penetration depth, whereas the phased array has the lowest frequency and has the highest depth of penetration of about 35 centimeters. The curvilinear probe is in between these two and is mostly used for abdominal structures. We'll talk a little bit about transducer movements. So we have sliding, rotating, tilting back and forth, and rocking. Here is showing you what an ultrasound image looks like. Of note, to make the point of the orientation marker, and you have to look at the indicator on the probe. So in this picture, the indicator on the probe is pointing towards the patient's head. So therefore, the orientation marker on the ultrasound window is on the left side. And we'll also talk a little bit about tissue echogenicity. On the ultrasound machine, water or fluid is shown as anechoic or black, whereas bone, air, gallstones, pericardia, the diaphragm, it's hyperechoic, which show as the white stuff. And hypoechoic will show a little bit between, sometimes gray. And when you're doing ultrasound, it's important to make sure you have the optimal depth. So here in the first window, we can see that the depth is too deep. On the second window, you can see that the depth is too shallow. And on the side, you got the depth markers, and they're measured in centimeters. So an ideal depth shows beyond structures of interest without including extraneous structures. For example, in these two windows, we are looking for the internal jugular vein for central line placement. So you want to make sure you have the right vessel in the middle of the screen over here. And also, gain is also important on ultrasound. Gain signifies the degree of signal amplification, also known as brightness control. You don't want it to be too low where it's too dark to see anything, or too high where it's also too bright to see anything. So you want to find the middle ground, which is the optimal gain. And that's the best grayscale to differentiate between structures in the image. On the ultrasound machine, there are two modes that are very important and widely used. First is the default mode, also known as the brightness mode, or B mode, which is just a two-dimensional image of the structure you're looking at. And another mode is the M mode, which stands for motion over time of structures seen in a single axis. As you can see from this line over here, that is what it's showing over here over time. Here, the IVC walls are moving closer and further apart with each breath. Next, we'll talk a little about Dopplers. So we have color flow Doppler, pulse wave Doppler, continuous wave Doppler, and power Doppler. And each of these have their own uses and are very powerful. Going back a little bit. So the color flow Doppler, which allows you to see the general flow, direction, and velocity within the region. This is used to differentiate valve regurgitation, stenosis, and the color signifies which direction the blood is flowing. So blue means it's flowing away from the probe, and red is towards the probe. The mnemonic you can use is BART. Blue away, red towards. The second image shows pulse-wave Doppler, which limits to the interrogation of flow velocity and direction along a single line at a certain depth. Next, we have continuous wave Doppler, which records every velocity along a defined path. This is similar to the pulse wave Doppler, but this allows you to record high velocities. However, you are unable to localize where the individual velocity comes from compared to a pulse wave Doppler. And a power wave Doppler. This is more sensitive than a cutoff Doppler in detecting blood flow, although it does not provide information about the direction of blood flow. It provides greater detail about blood flow in an organ, such as testes or ovaries. As you can see here, in the testes, there is blood flow. So, some take-home points. Fluid is black. Bone, air, diaphragm, pericardium are white, and other soft tissues are shades of gray. The indicator on the transducer corresponds to the orientation marker on the image. Use the high-frequency linear array probe for vessels, since those are more superficial, and the lower-frequency phase array probe for chest and abdomen. And a curvilinear probe is best for intra-abdominal structures. And you make sure you adjust the depth and the gain for each exam to make sure you are seeing the picture correctly. Thank you. These are my references.